All right. Good morning, everyone. Happy Friday. Happy March. Hopefully it's a sunny day where you are. Thanks so much for joining in on the latest installment of Advocates for Ohio's Future budget webinar series. Today, we are taking a dive into the childcare provisions of the state budget as proposed, as well as giving you a heads up on some policy and some funding that was included in the American Rescue Plan that was just passed at the federal level. We'll also talk about a P-EBT update and talk about, again, some changes happening on the federal level, making sure that nutrition support is getting out to kids and families across Ohio. A few brief announcements before we begin. We know that a lot of our stakeholders, a lot of our audience is keeping a close eye on Senate Bill 17. That's currently under consideration in the Senate Government Oversight and Reform Committee. Here to tell you that that bill is not up for another hearing next week. We did have that opponent hearing back in February and on all quiet for now. So we are keeping our ear to the ground on that bill and will of course let you know if there's any changes in status. As far as the budget process overall, the Finance Committee had testimony on the budget bill last week. We expect to see kind of the first round of changes, this sub-bill to be revealed either next week, maybe the following week. We do know that the legislature is heading into their spring break time, so they might be hard at work hammering out those changes, but we will of course notify you and let you know when that kind of first glance at the changes that the House Finance Committee and leadership are looking for in the budget bill coming up in the next week or so. So it's exciting time. Stay tuned. This webinar is being recorded and all slides and the presentation will be available at advocatesforohio.org/webinars by noon today. I am very excited to have two great AOF friends with us today to present and share information with you. First up, we'll have Will Petrik. He's a budget researcher with Policy Matters Ohio. And then on deck will be Rachel Cahill. She is a consultant with the Center for Community Solutions. So whenever you are ready, Will, we will go ahead and get started. Kick us off.
Great. Thank you, Kelsey, and thank you, Advocates for Ohio's Future, for hosting this event. And thanks for everyone who's joining us today for your interest in these issues. So again, my name is Will Petrik. I'm with Policy Matters Ohio. Our mission is to build a more equitable, inclusive, sustainable, and thriving state. And we're part of Advocates for Ohio's Future because we believe that all Ohioans, regardless of what we look like or where we live, deserve basic human dignity. We all need to put food on the table. We all need to pay the rent. We all need to support ourselves and our families. So that's a big part of why we're here today. Before getting into like the details of the state budget, I think it's really important to talk about why access to high quality childcare matters for kids, for parents, and for the economy. I'll also provide a little bit more context about the moment that we're in. So, how has the pandemic impacted kids and families and childcare providers? And then after that, I'll be, providing those updates on the state budget and also talk a little bit about the federal stimulus bill that was just passed last week. So yeah, in terms of like, why is childcare so critical? I think about this African proverb of it takes a village to raise a child. So, we know that families have changed. We know that our society has changed and families are facing enormous challenges as a consequence of the pandemic. And if you're a parent, I think you can't do it alone, right? Like it takes all of us to really support our kids to help them grow and thrive. And a big part of why high quality childcare is so critical is, the research really shows this is critical for helping prepare kids for the future. I believe that every child deserves to be safe, deserves to be cared for, deserves to be educated. And high quality early education does just that. It really improves kids' health outcomes, educational outcomes, and economic outcomes. It's also really critical to support working families and working parents and make sure that they have support. So, we believe that all parents deserve to be able to go to work knowing that their kids have a safe, nurturing place to go. And finally, childcare is so essential because it's a critical infrastructure for our economy. It helps parents stay in the workforce. So we call childcare the workforce behind the workforce. So again, even before the pandemic, and you can go to the next slide, Kelsey, for decades, Ohio has had a childcare crisis. So, parents who live in Appalachia, Black and brown parents, have less access to high quality childcare options in Ohio. We know childcare is unaffordable for far too many families, and early educators make poverty level wages. So this slide specifically highlights that. So our childcare system is really built on a foundation of a low wage workforce that's primarily women and predominantly women of color. So 95% of the workforce is women, and they make an average of just $10.65 an hour. So just to take a step back, these are workers who are performing an essential role, right? They're taking care of our kids, they're caring, they're loving, they're teaching our children. And again, they're helping parents stay in the workforce. And these low wages really reflect how we as a state undervalue this critical work. So I think it's really important that we ensure childcare workers make a living wage. In particular during COVID, these workers have been on the front lines. They've been caring for children of nurses and doctors, of grocery store workers, of other essential workers all throughout the pandemic. And so, it's really critical that we support these workers. You can go to the next slide. So this slide shows just how unaffordable childcare is for thousands of working parents across the state. So I know the text is a little small, but basically the average cost of center-based infant care in Ohio was just over $10,000 annually in 2019. That's for one infant. Say you have an infant and a 4-year-old, your average cost is over $18,000 each year. So this table specifically highlights that the US Department of Health and Human Service states that the affordable childcare should be no more than 7% of your family income. And this chart really highlights the average cost of childcare is not 7%. It's well over 7%. And particularly if you're, say, a single parent at the median per capita income, you could be paying over half of your income for childcare. So this just highlights again how high quality childcare is unaffordable and out of reach for so many families even before the pandemic. You can go to the next slide. So this graph really highlights the lack of state support. So, states have what's called publicly funded childcare, and states basically can make childcare more affordable and more accessible for families with low income. And Ohio is basically near the bottom among all 50 states when it comes to state support for making care more affordable and accessible. So again, just for instance, if you're a single mother of 2 kids and you're making $15 an hour, you make too much to qualify for this public support. And at the same time that you make too much, if you're trying to actually put your kids in childcare so that you can go to your $15 an hour wage job, you're basically spending over half of your income on childcare and don't have enough really left over to pay the rent, to pay for food, to pay for healthcare. So in Ohio, our initial eligibility is set at 130% of the federal poverty level, and that's people who are eligible, families who are eligible, or parents for this publicly funded childcare program. So that means a parent with 2 children, so this is a family of 3, 130% basically means you have to be making $13 an hour or less. If she makes more than that, she makes too much to qualify for this public support. So this is a critical policy lever that lawmakers can use to make childcare more accessible and more affordable. And we, as well as Advocates for a House Future, are asking state lawmakers to increase initial eligibility up to 200% of the federal poverty level. You can go to the next slide, Kelsey. So those were, longstanding existing challenges. Many of these challenges have been exacerbated by the pandemic and by the recession. So, even before the pandemic, childcare providers operated on razor-thin margins. Like other businesses, childcare providers had to close or reduce capacity during the beginning of the pandemic. And some childcare providers have totally had to close their doors. Most have reopened and are struggling to stay afloat. They're serving fewer children. There's also additional costs associated with the health and safety regulations related to COVID. So this national association, it's called the National Association for the Education of Young Children. They've done several national surveys where they're hearing from childcare providers all across the country. And the survey found that 81% of childcare providers were serving fewer children than before the pandemic. 91% of providers reported paying more for cleaning supplies, and 56% of facility owners basically said that they're losing money on a daily basis. So this all just goes to show how, as a business, if you're a childcare provider, the pandemic has brought on a lot of different challenges to the business model. And when you look at the Ohio's publicly funded childcare program, before the pandemic, on an average month, the publicly funded childcare program was serving roughly 113,000 children. That program is now serving roughly 97,000 children. So that's roughly 16,000 less children compared to before the pandemic. So next slide. So what does this mean? And how does this impact kids and families and our economy? We know that it's really hurt kids and families. One of the biggest challenges of COVID is the loss of community and the loss of family support. I know that I personally am really longing just to spend time with my friends and family and hug people and just make those connections. And we know that kids need other children. They need other adults. They need those relationships. They enrich children's lives and they enrich their experience. There's also, one of the key metrics for educational outcomes for kids is called kindergarten readiness. So this is basically a metric where the state determines, how many children entering kindergarten are ready to learn, ready to engage, ready to grow. And in Ohio, only 26% of Black children start kindergarten ready to learn. Broadly, for all children, the number is only 41% of all children. So, this just goes to show that we need more early education options. We need more high quality childcare and not less. The other thing that's critical about that is we also know that kids who start behind often stay behind. So if you are a kid who's starting kindergarten and you're not able to engage and grow and learn, you're likely going to be behind in elementary school and middle school and high school and on into the workforce as adults as well. So that's, there's a detrimental impact on kids. We've also seen huge challenges for parents and particularly mothers. So many parents are still scrambling to try to find childcare options. I have colleagues who are stressed day in, day out and exhausted because they're struggling to try to work and take care of their kids. We know that parents will not be able to fully return to work without safe, affordable, and accessible childcare. Another bit of a report from the National Women's Law Center found that more than 2 million women have left the workforce since the pandemic began in 2020. And 2020 December report from the Bureau of Labor Statistics also indicated that women were leaving the workforce at 4 times the rate of men. So again, this has had a huge impact on mothers and women. The childcare sector has also lost a significant number of jobs. So roughly 17% of childcare workers have lost jobs since the start of the pandemic. Again, this largely hurts women who make up most of the workforce, and it disproportionately hurts Black and brown women. So, that all just goes to show that the pandemic has really shown how the lack of reliable, affordable childcare can really knock parents out of the workforce. It can send shockwaves through our entire economy. So again, that's why we talk about the childcare as the workforce behind the workforce. We think it's critical in terms of restarting our economy that we address the childcare crisis. And as we recover, we really need to build an early care and education system that supports all kids, all of our families, and our economy. So you can go to the next slide. So I hope that provides a little bit of context for kind of the moment that we're in. So what's in the governor's proposed budget? So this table highlights that there are new investments, but it is all federal dollars. So there's no additional state support. So on the right side, you can see the percent change. So that federal child care line item 617, that's the child care development block grant. So there's a 28% increase there compared to the last 2-year budget. There's also an increase of 11% for childcare in the TANF service framework for this 2-year budget as compared to the last 2-year budget. So what does that mean? 2 main things. So the Ohio Department of Job and Family Services is using these additional federal dollars to increase reimbursement rates for childcare providers. So the cost of childcare continues to increase, and it's increased substantially over the past 2 years. So basically, base rates for publicly funded childcare providers have to be increased to at least the 25th percentile of the market rate to stay in compliance with the Child Care Development Block Grant requirements. So we're glad to see this rate adjustment that will help providers across the state. The other thing that this will do is, the proposed budget takes a step toward making care more affordable and more accessible. So, we talked earlier about the need to increase initial eligibility to 200% of the federal poverty level. This takes a smaller step. So it increases initial eligibility from 130 to 138% of the federal poverty level. So according to ODJFS, this will mean the state will serve an additional 2,000 kids in fiscal year 2022 and 2,500 kids the following year. They're also increasing eligibility to 150% for children with special needs. So this will mean serving an additional 100 children with special needs in fiscal year 2022, and roughly an additional 250 the following year. So, this will make a difference, and we really want to see lawmakers take a larger step. We want to see childcare be affordable for all who need it. So again, that's why we're asking state lawmakers to increase initial eligibility to 200% of the federal poverty level. Just an important advocacy opportunity. So as I think probably folks know on this call, so the budget is House Bill 110. There's also a new bill in the legislature called House Bill 145. This is a bill that has bipartisan support, and this would make childcare more affordable and accessible. It increases eligibility to where we want it to be, up to 200% of the federal poverty level. So this is something where the sponsors of the bill gave testimony last week. It's in the House Families, Aging, and Human Services Committee. So if you're interested in speaking up on either of these bills. The budget bill is House Bill 110, and the Child Care Access Bill is House Bill 145. You can go to the next slide. So the other important context of this moment is, the American Rescue Plan was signed into law last week. It was truly historic. It will provide meaningful relief for kids and families and childcare providers. So, what's in it? So there was a $39 billion investment in childcare, $15 billion going to the Child Care Development Block Grant Program to help each state with the quality rating system and to help families access childcare. There's also $24 billion to create what they call a child care stabilization fund. So what does that mean for Ohio? As you can see from the slide, we anticipate seeing $500 million for expanded child care assistance and $800 million to help stabilize child care providers. So the stabilization funds are going to be relatively flexible funds to support child care providers. So they can cover a range of expenses, PPE, personnel. They can go toward rent or facility maintenance or improvements. They can also go toward goods and services to resume providing childcare for folks who haven't or who have been closed through COVID. So there's significant resources there to support childcare providers and really sustain childcare providers through this pandemic. The federal bill also made an additional $1 billion investment nationally for Head Start and early Head Start programs. You can go to the next slide. There's also going to be relief for families. So we talked about just how so many families struggle with childcare affordability. So, the stimulus bill really provides unprecedented resources for kids and families. So there's going to be these $1,400 stimulus checks that will likely be coming into people's bank accounts soon. And then there's also a historic reform in the child tax credit. So there's an expansion of the tax credit from $2,000 to $3,000. And there will be an extra $600 supplement for kids 5 years or younger. And this is refundable now. So this will really impact, over 2.3 million children in Ohio. And just mean more money back in the pockets of families. So this will be money that people can spend really on their basic needs. So it could be food, it could be housing, it could also be toward helping pay for childcare. There's also a higher limit on what's called the Child Care and Dependent Tax Credit. So this is a tax credit that families can take who have childcare expenses or senior care expenses. So this could include something like hiring a nanny or paying for an in-home senior care. It also can help with sending kids to childcare or summer day camps. So basically this will allow parents or guardians to deduct the cost of caregiving for their dependents for up to $4,000 for one child and up to $8,000 for 2 or more children. So again, this will help people be better equipped to pay for childcare. You can go to the next slide. So, I think it's important that we still need to address the long-term childcare challenges. So the American Recovery Plan is historic, and it's meant for one-time immediate relief and really to plug holes. So it will help the childcare landscape and infrastructure and childcare providers. It will weather the storm, but really it's not going to address the long-term structural issues in our childcare system. And the tax credits that I mentioned in that last slide, these are all currently for 1 year, for 2021. So this will be an important advocacy effort to really continue that support and make those changes permanent. But again, the American Rescue Plan is really a short-term stimulus, short-term recovery investment, and it's really critical that we think about long-term fixes for our childcare system. So, we must build on this. We must sustain it with new revenue and new investment in the state budget. It's really up to us as advocates to change the way we think about really investing in kids and families. So, we just highlight on this slide some of the core values that we've been pushing for in the state budget. So, really one, access and affordability. We want to make sure everyone who wants childcare can afford it and help parents get back to work by making childcare more affordable. So again, we're asking lawmakers to expand initial eligibility to 200% of the federal poverty level. We also want to make sure the system is sustained and make sure childcare staff are safe and healthy, children are safe and healthy, and that childcare providers can keep their doors open. Quality is also really critical in terms of all those outcomes for kids. And then finally, equity is an important principle that we need to continue to center and lift up. So there's long-standing structural barriers and concrete policy choices that lawmakers have made that have kept many kids from being able to have opportunity, from following their dreams. And the state budget is really an opportunity to put our kids first and really invest in children and families and make targeted investments in children and families who have historically been excluded. This means investing in Black and Brown Ohioans, in rural Ohioans, and our youngest children. So with that, I just want to say thank you. I think the next slide just has my contact info. So if anyone has questions or interest in learning more, definitely feel free to reach out. But thank you again, Kelsey and Advocates for Ohio's Future for having me.
Of course, well, thank you so much for your presentation. And next up, Rachel Cahill, again, Center for Community Solutions consultant. You're up. Excited to hear your presentation.
All right, well, good morning, everyone, and thank you, Will, for that terrific rundown of childcare. I learned a lot, so thank you for walking us through that. And we're gonna stay on little kids. I am an expert. I have 3 of them myself. One of them is currently running around in the background. So yeah, we're gonna talk about little kids today. I will admit I am a SNAP person. So I'm going a little bit left and right of my expertise talking P-EBT and WIC today, but I thought that in the theme of little kids and the importance of child nutrition, that this kind of fit nicely with what Will was presenting. And also there's just some exciting updates I wanted to share with everyone here today. So Kelsey, if you can go to the next slide. So let's just, I'm not going to stay here too long, but it is important to remember, maybe all of us know, but Ohio's child hunger crisis really continues. It has been really terrible, devastating in the last year. We saw in December, we saw the rates of child hunger 10 times higher than we saw the year before. So December 2019 to December 2020, it was a multiple of 10. That's how bad the crisis has gotten because of the pandemic and all of the inequities that it has exacerbated in our food system. So this slide just gives you kind of the latest update on child hunger. It has ticked down a little bit since January, which is good news. In January, it was about 31% of households with children in Ohio faced food insecurity. It's gone down to about 22%, but that's still 1 in 5, more than 1 in 5 households with children in Ohio. And it's especially stark among Hispanic and Latino families with children at 38%. So I think that it in part is reflective of the fact that the immigrant communities and mixed immigration status families have been left out of a lot of the federal pandemic relief. And so I just want to spotlight that for folks so that that we're continuing to lift up that problem and making sure that we're making all of our families whole and making sure they all have access to nutritious food. Okay, so pandemic EBT is one of the solutions that Congress came up with last year to solve the child hunger crisis as schools closed across the country. A lot of you are probably familiar with it and have heard previous webinars I've done for AOF on P-EBT. So this is just a quick reminder of what we've already done. We are on round 3 of P-EBT. Round 1 was last spring. We reached 872,000 children and distributed about $260 million. And by we, I mean the Ohio Department of Job and Family Services and Department of Education did a terrific job when the crisis hit last spring, getting P-EBT out the door. There was round 2 in the fall. It was just for August and September benefits, and that went to just under 500,000 school children who were fully virtual at the beginning of the school year. And then in October, Congress extended P-EBT for the rest of this school year and also included little kids, which I'm going to get to in just a minute. But staying on the school kids, Ohio kind of already knew how to do the school kids, so they rolled out 3.0 P-EBT in February after new guidance came out. So they were one of the first states to get the full school year plan approved. And their initial estimate was that that was going to reach about 600,000 kids who were in school either hybrid or remote schedules, not fully in person, and that was going to distribute roughly just under $500 million in food assistance to families. And the picture on the screen is that P-EBT card. That's what it looks like. You use it like a debit card. It runs on the rails of SNAP, so you can use it all the same places that a SNAP EBT card is accepted. It's been a tremendously positive and effective program to address child hunger. It's not enough, but we need all of these solutions, right? Along with everything the food banks are doing and the schools are doing to continue to feed families and help us make it through the rest of this crisis. All right, so that's the refresh on P-EBT. Next slide, please, Kelsey. All right, so I mentioned that Congress expanded it to younger kids as well in October. Unfortunately, it took a really long time for us to get guidance on how states could implement that program. It was not until the Biden administration took over in January that guidance came out, although it was a top priority for them when they came in for the new administration. So the guidance came out on January 29th. And this is for states to figure out how to get P-EBT benefits to children who are in SNAP households and are under the age of 6. Unfortunately, the eligibility for P-EBT was constrained at the federal level just to SNAP households, to children in SNAP households. It is not as expansive as P-EBT for school-age children, which extends to non-SNAP households as well. And in fact, is the majority of that program is non-SNAP households. So we know that a lot of little kids are left out of this. This was a budgetary constraint in the back in October when Congress passed this expansion. So it does only include SNAP children at this moment. There's also a data element to this because we don't have the kind of robust childcare eligibility data or childcare participation information, like student level information. There weren't as many practical ways to identify all the eligible kids the way that there was in school, where we have school enrollment files that the schools are actually sending up to the state. So I'm happy to answer any technical questions people might have on that, but there were a couple of reasons that P-EBT was limited only to SNAP households. So the last update that I received is that Ohio is actively working on their plan for federal approval. It may have already been submitted. I know they were kind of in the final stages of finishing up their plan. Only 3 plans for the under 6 children have been approved so far federally. Arizona was the first one in February 25th. The other 2 are Massachusetts and Indiana. And those were early implementers for the school age children as well. So they have some stronger data systems that they're relying on. So hopefully Ohio's plan will be submitted, if it hasn't already, and accepted by the feds pretty quickly, and they can start to roll that out. But when we have a more complete update on that, I will be sure to hop back on an AOF webinar to share it with you all. We did make a recommendation to Ohio to follow Arizona's plan, and I'll just say a word about that. Again, we don't know yet if it would be approved and if this is exactly what they will propose, but Arizona is using a county-based plan, which basically says if any school district in a county operated remotely during that month, then all of the children in SNAP households under 6 would be eligible for P-EBT that month. So that is very practical in a county administered state like Ohio, as opposed to trying to line up eligibility with school district boundaries or look at zip code data. You know, a county-based approach would be kind of cleaner. It would also hopefully be pretty inclusive, given that there have been lots of different school operating models throughout the state, that would be a good proxy for how to estimate the little kids' eligibility. So the take-home message for SNAP under 6 P-EBT is encourage families who are, you know, in childcare, little kids, any families with children under 6 should be encouraged to enroll in SNAP if they qualify, because SNAP is going to be the gateway to P-EBT for the little kids. So if you take nothing away from this presentation, please remember that, and please encourage families to apply for SNAP. All right, next slide. So the other really exciting news about P-EBT is that the American Rescue Plan expanded it for the summer. So the original legislation just was going to take us through the end of the school year, which was great, but we know that child hunger spikes every summer because kids lose out on those school meals that they were receiving. This could actually be the first summer that doesn't happen, because we are going to be expanding. So P-EBT plans can be continued into the summer months. And that would include all the kids who are getting it this school year because they were in hybrid or remote schedules. It would also include the kids who are getting in-person meals, right? Schools that never closed or have mostly been working in, operating in person this year. Presumably those children will also be eligible for this new summer benefit through P-EBT legislation, which is just so exciting. We're still going to need to wait for guidance to come out from the federal government to tell us exactly what states can propose and how this plan would work. But the legislation does allow for up to 90 days of a summer benefit for P-EBT. And right now for the school year, the benefit value is $6.82 per day. So, should we be able to do a full 90 days of benefits, that could be upwards of $600 a child that we're talking about in food assistance benefits, on top of, families that qualify for SNAP and additional supports that are available at child feeding programs, summer meal sites, all of that great activity that our community always does every summer, but doesn't reach all the kids that need it. Will be a huge new opportunity for us this summer too. So stay tuned. Again, as we get more guidance there, we will certainly share it so that we can plan to make the most of P-EBT in the summer. All right, so let me pause for a second and see if any questions came in on childcare. Let's see. Oh, childcare related question. Okay, not about P-EBT. We'll save that for Will then. All right, let me talk about WIC for a second. So for those who don't know, the full name of WIC is the Special Supplemental Nutrition Program for Women, Infants, and Children. And it is a long-standing, highly successful nutrition assistance and healthcare and breastfeeding support program for mothers and for their young children. I can't overstate the research that is there behind WIC to show how effective it is. But the downside of WIC is that participation has been dropping in recent years. And there's some reasons for that I'm not going to get super deep into, but some of the reasons is that the program isn't operated as, in an as modern form as SNAP and some other programs. So there's a lot of in-person requirements. There are some technology barriers to participation. The benefits are not as high as they could be and should be, I think, to fully support those families. So there's a really important investment that was part of the American Rescue Plan, $880 million for some of these initiatives in WIC. And it gives the Secretary of Agriculture a lot of flexibility to do some really cool, innovative things. It also increases the value of the WIC package by up to $35 a month. Again, there'll be guidance that comes out on exactly how this works, but that's going to allow for more fruit and vegetable purchases for participating WIC families. And, if you talk to WIC participants, you would know that the value of that benefit and being able to sort of make it worth your while to go to the grocery store and find the special items that are included in the WIC package is something that we need to be investing in the program if we want to see those participation numbers go up. So just to give context again for anybody who doesn't pay close attention to WIC or doesn't know the program well, if you can go to the next slide, Kelsey, I just wanted to highlight this opportunity to really support outreach. I think that everybody on this call who cares about little kids and their well-being should just have this baseline understanding of who WIC is reaching in Ohio. Less than half of eligible children less of eligible participants in Ohio are participating. So our coverage rate, now this data is from 2017, which is the most recently available data. It hopefully went up during the pandemic when some flexibilities were adopted, but it was, just under 47% of a participation rate. By comparison, SNAP's participation rate amongst families with children is, close to 90%. So there's a big gap between SNAP participation and WIC participation for families that should be eligible for both. And the chart on the left just shows you that there's a big difference in who misses out on the WIC benefits. There's good participation among infants. Families know that WIC is there for them to support breastfeeding, to support formula as needed, and really that immediate postpartum period. But you can see that the child participation goes down significantly as you get into those preschool years. And so that is where, again, this community, people who are engaged in childcare and who are caring about little kids, could really help us strengthen WIC in the coming year, and to take advantage of this new federal investment that's there to do that. So because I'm a SNAP person, I would be remiss to not mention SNAP on this webinar. There was a terrific investment in the last package, the last two packages actually, to increase the SNAP benefit by 15%. We call it the SNAP bump, is what USDA calls it. And that took the minimum or the maximum benefit for a household of one from $204 a month to $234 a month. And overall, it's about $28 per person of an increase in the benefit. So is it groundbreaking, earth-shattering, totally going to change child hunger? No, but it's a step in the right direction, and it's a step on a path to ensuring benefit adequacy. I don't think most people realize that the SNAP benefit only provides about $4 per person per day. It is not a generous benefit as it is, and even with this bump, it does not even get up to what USDA calls the low-cost food plan and what it would cost to afford that. So we see this as like an incremental step to really transforming and making the SNAP benefit more adequate. Also important for folks who haven't been close on SNAP to know that emergency allotments are still in place. These were put into place last spring, and they bring every family up to the maximum benefit for their household level. So if you normally, based on your income, would qualify for $50 a month, in your household of one, right now you're getting $234. So it is a huge benefit that people should know is there, but it will only be there as long as Ohio has a public health emergency declaration in place. So I think this is something that advocates really need to watch. If the legislature and the governor start talking about that emergency declaration fully being rescinded, we would immediately lose that emergency allotment, and it would have a big impact on a million families in Ohio. About 2/3 of SNAP recipients in Ohio are benefiting right now from the emergency allotment. So while we have it, let's use it, and let's ensure that families are getting it. So encourage families to enroll in SNAP. I know it's hard. I know that it can be very frustrating, and it can be complicated with the paperwork required. There are lots of resources and food banks that are well equipped to help, in addition to our county partners. So please reach out to me if you are interested in supporting a family or a community that wants to do SNAP outreach to make sure that we're getting families to take advantage of that 15% bump, the emergency allotments, and if they've got little kids, that P-EBT benefit that's going to be tied to SNAP participation. So that's it for me. I think the last slide just has my contact information. Please let me know if you have any questions, and I think we have some time for questions now.
We do, Rachel, thank you so much. I always learn a ton during these webinars, and I really appreciate your time and effort that you put into to preparing for this and sharing your expertise with us. So we did have one question in the chat. I believe Will addressed it within the chat about eligibility for publicly funded childcare in Ohio. Just one thing I wanted to clarify. So that kind of little bump is in the governor's proposed budget. So we won't know if that makes it till the end until the end of June. And Will, if you would maybe talk about the process of maybe some changes we could see, if we've heard some maybe support or maybe pushback from the legislature, just kind of your interpretation of how that might move forward.
Yeah, it is important context that we're basically in the first draft now of the budget. So the governor's proposed the executive budget. It's now in the House, and we'll likely see changes in the House, and then it goes to the Senate and then to conference committees. So there will be opportunities for everyone on this call to weigh in and to try to shape the budget. I did hear, I think, so Groundwork Ohio, who does a lot of work on early childhood education. I know that they're working with some lawmakers to try to get an amendment included in the budget to increase initial eligibility to 150% of the federal poverty level. So that's something that when Governor DeWine was candidate DeWine, he made this commitment to make childcare more affordable, to make it more accessible, and specifically made a commitment to increase initial eligibility to 150%. We were disappointed that that was not in the first budget in his administration, and are pleased again that there's a step that was taken to increase it to 138%. But yeah, there's a lot more work to do to make sure everyone has access and make sure everyone can afford childcare.
Great. Thanks so much for that context, Will. Once again, folks, please feel free to add your questions to the chat. I actually have a couple questions for Rachel while I have her here. Talking about the low-cost food plan at the federal level, I know we saw some talk about that kind of being re-examined, maybe some steps to kind of increase SNAP overall, and those allotments being initiated by the federal administration. Kind of what might that look like? Maybe a timeline in your eyes, Rachel.
Yeah, great question. So yeah, there are two terms of art here that are worth defining quickly. So there's the thrifty food plan, which is the absolute bare bottom basic budget that the USDA calculates for the cost of food. And that includes like soaking your own dry beans and taking hours to cook, buying everything, like buying everything scratch and cooking everything from scratch. A very June Cleaver 1950s picture of what moms and dads, can do when it comes to feeding their children. So the thrifty food plan is what SNAP is currently based on, and that is what gets us to that, $1.50 per meal per day amount. What the Biden administration has committed to do is to re-examine that thrifty food plan and how it's calculated in a scientific way. And so that process is underway. It was actually required by the 2018 Farm Bill, but was just stalled. So it's happening now, and we expect that by actually looking at families' purchase behaviors and needs, and for instance, differences in what a preschooler needs versus a high schooler needs, we will get a recalculation of the thrifty food plan. And that by itself, even if Congress does nothing, could raise the value of the SNAP benefit because it's based on that thrifty food plan. That is not expected, though, to really be done until fiscal year 2022. So we've got at least a year before we probably see anything on that front happen. In the meantime, I think advocates continue to raise up for Congress the need to actually move from the thrifty food plan to the low-cost food plan, which is like the next rung of 4 on how we calculate and what the cost of food in this country. So that's kind of a long-term goal that we continue to work for to get to benefit adequacy.
That's great, Rachel. So little steps forward at a time, but I'm glad that we're moving in the right direction. So Will, we had a question come in the Q&A. From one of our listeners, heard that some state legislators are opposed to the Step Up to Quality system and or the use of TANF dollars to support it. Do you have any context around that or thoughts on how that might play out?
Yeah, it's a really great question. And actually, I'm as a part of Advocates for Ohio's Future, I co-chair the TANF work group with Graham Bowman at the Ohio Poverty Law Center. And so we talked about this recently. So when the state budget was, there was a hearing in the Health and Human Service Subcommittee, and one of the state lawmakers, I think it was Representative Edwards, questioned the Job and Family Service Director specifically about quality childcare. So just for context, for people that aren't familiar, there's what's called Step Up to Quality. So this is a quality rating system where now all providers, all childcare providers in the state of Ohio that provide publicly funded childcare have been rated now. It's a scale from 1 star to 5 star. And, essentially it's a way both to show to parents, what rating childcare providers have and the level of quality. And it's also something that quality costs money, right? Like in order to have a higher quality setting, you have staff that maybe have higher education or more training and more resources go into that. And so the question around childcare quality was, we're in this moment of the pandemic where we have thousands of families who have lost their jobs, who have lost income, and basically I heard it as kind of like a false choice between, we need both. It's a both and, right? Like all kids deserve food. They deserve housing. They deserve their basic needs to be met. And we also need quality. All kids deserve to start kindergarten ready to learn and grow. And it's not an either or. In TANF, there's the cash assistance program that's really critical to support particularly very low income families. And a lot of the TANF dollars go toward childcare and high quality childcare. And so the state legislature and ODJFS actually specifically put out what they call the TANF service framework. And it highlights that, childcare does take up a decent slice of the pie of the TANF spending. And over time, will gradually start to get less of that. So there is this need for again, ongoing state support. We need GRF, we need sustainable long-term support, again, both for quality of childcare and to make sure people can access it and make sure it's affordable. And we also need cash assistance for families so that they can support themselves and make sure kids aren't going hungry. So, our position is we have the resources to do it. We need the political will to pay for it, and also to make sure that the most wealthy Ohioans are paying their fair share to support kids.
That's really helpful, Will. Thank you so much. We know that's kind of a long-term conversation among AOF and our partners to, again, ensure that we support both programs and we know how important they are for families, and recognizing that there is, a time down the line in the next few years where we have to have those really serious conversations about continuing quality and finding sustainable funding. So we will continue to be part of those conversations, and thanks for that kind of overview. Well, that was perfect.
Yeah, and thanks for the question too.
Certainly. Rachel, I had a question about the WIC program. So it really struck me that only half of eligible Ohioans and children and moms and parents are part of it. I'm wondering, what does that eligibility look like in Ohio? How do they apply? Just kind of give us maybe the ground level of how we can encourage folks to take advantage of this program.
Sure, and we should probably do a whole webinar on that with some WIC clinics that could give us better insight than I can, but just very high level. WIC is a federally funded program that is it's at 185% of the poverty level. So it has, a little bit higher eligibility than SNAP generally does. And it's really a clinic-based program. So it often aligns with the healthcare setting. A WIC clinic is sometimes in the same space as healthcare clinic or other community sites. And it's really it's very healthcare and nutrition grounded. So there are in-person appointments, you're meeting and you're talking about the nutritional risk. They're assessing the nutritional risk for the family. And so it operates very differently than SNAP in a sense where SNAP is kind of transactional, right? You get the benefit and you spend it independently at the grocery store like everyone else. So WIC, once your nutritional needs are assessed, you basically get like a prescription for food. And so that gives you certain foods that you can purchase. There's a very, sort of limited foods that you can buy on WIC. Again, unlike SNAP, which is which is just mainstream shopping for groceries. And so it's things like, very healthy food, vegetables, fruit, grains. There's an allotment for proteins, so it's a very targeted package, and that package is actually targeted to those different sort of nutritional needs of the different ages of the children and the women at different ages of childbearing. So, it's a sophisticated program, but the reason participation is low because that might mean you have to take time off of work to go to your clinic appointment, right? You have to recertify your benefits more frequently. And in Ohio, we have what's called like an offline system. So you actually have to physically go get your WIC card like reloaded, which they had to come up with some really creative solutions to deal with during the pandemic when, that was much more challenging. So, again, I don't want to step too far out of my comfort zone here, but I think that we do need a broader conversation in Ohio about WIC and how to make better use of it for our little kids. And I'd love if anybody here on this call is a WIC expert and wants to volunteer to team up with me for another webinar. I would love to do that with you.
I love that. Thank you, Rachel. I think that's definitely within AOF's wheelhouse, and we would be happy to host and start and kind of get that conversation going in Ohio, because that's really interesting. And certainly look to you and your partners to lead us in that conversation.
Yeah, just one other thing I'd add, and I think that this is going to be something that's a focus for the new federal administration, is this interconnectedness between programs, right? We often, I know I'm from Nebraska, and so I think it's funny that people always call them silos. Like we had a lot of grain silos where I was growing up. But, it is somewhat true that we kind of know our domains and we don't do a great job of talking about how they interconnect. I do think that the Biden administration is saying a lot of stuff that encourages me about the interconnection of programs and explicitly putting money into the field to say, who on SNAP isn't on WIC and how do we get them connected, and who on WIC isn't on Medicaid, and who's getting childcare subsidies is not getting SNAP. Right? Like we know who these families are in our systems. We just need to invest in the technology and have the creativity and the political will to actually make sure that families are getting the full package of support that they need. So I think WIC belongs, right at the table with that conversation, even though it's not administered by the Ohio Department of Job and Family Services that administers some of the other programs.
Well said.
To that point, I think one important thing with increasing childcare initial eligibility to 138% is that aligns with Medicaid eligibility for the Medicaid expansion. So, there could be some interesting administrative things done that, if those are aligned, if you access Medicaid, there's a message that says, hey, you're also eligible for support for publicly funded childcare. So yeah, I think thinking across systems is going to be really critical for just generally supporting kids and families.
All right, folks, so we are at the end of our time together this morning. Really appreciate and thank our presenters. It was very, very quickly, but we had a last quick question come into the Q&A. So threat level for Senate Bill 17. So as of now, so we know as written, this bill is very, very dangerous across systems, across Medicaid, SNAP, unemployment. AOF and our partners, and along with Rachel and Will, have been keeping an incredibly close eye on it. We continue to have conversations with the bill sponsor. As of now, the bill is not scheduled for another hearing in the Senate Government Oversight and Reform Committee. We're thankful for that. We anticipate, and kind of like truly knocking on wood here, that maybe if the bill is not brought up, the following week, that they will be too busy with the budget in the Senate to really kind of dive into Senate Bill 17. So we will continue to listen for thoughts. We did, under the direction of Senator Schaefer, meet with him, provide amendments and changes that we thought would help make the bill less harmful, to say the least, and have tried to be in contact with him. So we know it is a generally busy time in the state legislature, and we're just keeping our eye out, truly listening for any whispers on the wind about the will to move this bill forward. We know it was moving pretty quickly, but I do want to thank either those on the call and really everyone within our network for those who did step up and provide testimony, contact the sponsor, contact committee members, because I really do believe that your advocacy and your just sharing your experience and your fears on the bill and the impact it can have on families did so much to stop and kind of give the committee pause on the bill. So we want to thank you so much for your actions on it. As of now, I'll quiet, but we're listening for any kind of changes. Will or Rachel, if you've heard anything differently, happy to.
I just in the chat posted the Advocates for Ohio's Future sign-on letter in
Thanks, Will.
opposition to Senate Bill 17. I copied and pasted it from the email you sent out this morning, so hopefully that link works.
It should. It's super long, but it should.
It's a long link.
We'll bypass you through our website and all that good stuff. But no, that's fantastic. Thanks so much, Will. And you're right that sign-on letter has rolling enrollment, and we will continue to add supporters and organizations to that list as they come in. So we very much appreciate it. Oh, it works. Fantastic. Thank you so much. All right, everyone. We appreciate your time and attention again this morning. We'll be back here on Friday, April 2nd to talk about the sub-bill, if we see it, as well as kind of explain the process that will happen in the Senate with the budget. They're taking a new approach or different approach to how they'll hear the budget. They've come up with a system of track committees, which is interesting and new, but we're happy to kind of talk you through the process and give our thoughts on how it's going to play out. So thanks again for your time. Again, the recording and the slides will be posted at advocatesforohio.org in the next few minutes. And we'll see you again soon. Thank you again to our presenters. Always a pleasure. And have a great weekend. Stay safe. We'll see you soon.
Thanks, Kelsey. Thanks, Will. See you later.
Yeah, thank you both.
See you later. Thank you so much.